Hello everyone, welcome back to our channel. Now, as we have discussed and was discussing a lot of the things in regarding to the skin layers and a lot of things. In that, the skin tone, which actually gets a lot of concern, a lot of focus and a lot of your, I'll say a lot of people want to get it corrected because they don't like it. But you need to understand one thing, that whenever you want to tell your client something about the tone, you need to denote a number. Otherwise, when you are communicating it with either with the client or with your fellow colleague, you cannot name it that what kind of tone are we talking about or what we have to use with the treatment. Okay, very chaotic, no? Let's make it a little easier. See, there's a scale that is called as Fitzpatrick Scale, which actually takes care of your whole tone in the all over the world. Like the tones of the people, like the color of the people have been divided into certain grades. From grade 1 to grade 6, they have been equally divided out. Now, these grades basically react to the sun, or we call it as UV light, or to the treatments, or if we call them as to any of the treatments, how it basically react, how it basically looks and how it basically comes out in the natural light all the time, correct? So, when we are talking about the Fitzpatrick scale, so in the Fitzpatrick scale, if you see, there are 6 types or we call it as a 6 grades, okay? Now, if you look out over here, the grade 1, if you look over here, they are very fair people. They have the hair which are blonde. Again, all the kind of from top to bottom, their hair color is blonde, that is golden. They have color which is very fair like a milk, and at the same time the UV, the damage from the sun is not tanning, it is not giving a hyperpigmentation, but it actually burns the skin. So, on a contrary, when we are talking about the UV damage on certain skin types, it is very devastating. Similarly, when we are talking about with the grade 6, if you look at the outside or the last one, it is basically the darkest skin type in the whole, actually a whole scale. This basically UV, when it damages, so it doesn't burn, it basically tans easily, it tans out easily, it basically gets deeply pigmented. Any kind of treatment, whatever we want to do with them, we have to be very conservative and very precautious, because they can get easily hyperpigmented, okay? So, to learn about the Fitzpatrick scale, one thing you need to keep in mind, being an aesthetician in the field, why is it important for you to understand it? Because if you understand the Fitzpatrick scale properly, you can easily, target, or you can easily decide the type of treatment you want to do for the client, how intense you have to go, how conservative you have to go, and what kind of treatments, like very aggressive, conservative, or what kind of treatment you would need to imply or suggest to the client. Similarly, the kind of skin care has to be given, so where it has to be targeted more can be decided, and at the same time the UV damage, I'll say the index can also be initially calculated with it, correct? Now, as we move ahead, so if we understand it from 1 to 4, we are understanding it from 1 to 6. If you understand, if I want to do a chemical peel, okay, with these different skin types, so in the type 1, if you look over here, I can go from superficial to deeper peels also, because the skin or the kind of treatment I'm talking about, not the superficial treatments will just give a basic change and not a very, I'll say deep changes or any kind of very enhanced changes with the type 1. With the type 1, because they have a less melanin creating tendency, so we have this opportunity with us that we can go in a deeper layers or the skin. So we can use a medium and deep peels as well with them, which goes till reticular dermis. So that way the skin can get flawless, the skin can be treated easily. But similarly, when I'm talking about a move towards the grade 6, I cannot use deep peels with them. Reason? Because if I do that, I'm going to injure the skin, I'm going to irritate the skin the most, and I'm going to trigger the melanin content. and because of that hyperpigmentation will get triggered and more of the post-inflammatory hyperpigmentation will establish, and that will lead to the more of the darkening of the tone. So here I cannot use any of the deep peels randomly, okay. Superficial peels, very superficial peels, and maybe to some extent if the skin is healthy and actually working in our favor and the client is also managing it well, can go with the medium depth peel, but not with the deep peels. Please make it a awareness for that, okay. Now similarly, when we are talking about burning and tanning responses, we discussed it in the first slide as well. Again, I'll just let you know. See, the kind of skin which burns easily, then tans easily, there are difference, okay. So burning happens when the UV actually tries to infiltrate inside the skin and there is no defense mechanism onto the skin, okay. So what happens, basically this color which actually becomes a little irritating for certain people don't like certain color, but this color, this melanin actually becomes a defense shield. Yes, melanocyte produces melanin to protect the skin from the external damages or the internal as well, okay. So if you are a Caucasian, your skin may burn very easily because you don't have that defense mechanism. Here the defense mechanism is very hyperly active and very strong. So if you irritate it, it again start defending itself from any of the irritant which can be causing kind of temporary, or you can say the kind of basic irritation as well. So the skin burns easily, again burns easily, tan very difficult. Can tan, burn not very rarely, like rarely burns but can, but it tans also, okay. Now this tan easily, burns rarely, okay, it never burns, but it tans definitely. Now this tan definitely and never burns, okay. So similarly, what kind of skin tone tans easily, burns easily, you need to have an understanding, because certain kind of the skin tone requires anti-tan treatments more, whereas they require the defense mechanism more, as well as they require more of the protection, okay. So now as we move ahead, so Fitzpatrick matters. Why? So that the treatment selection gets easier, okay. Why the Fitzpatrick scale matters? So that treatment selection can get easier. Now when we are talking about any of the treatment, whether it is laser, chemical peel, MNRF, microneedling, or any of it, okay, we are talking about any of it, okay. So these are certain kind of depth involving professional kind of treatments which requires the skin to heal and to change, okay. So here the Fitzpatrick scale matters, because here if we see the treatment value, treatment selection can be taken, because when you assess the skin, then we make certain kind of discoveries, or we evaluate the skin, we check the skin, then we customize the kind of treatment or skincare for the client, and then we tell the client that this treatment will work in their favor or not. So in that, not just the skin type, what kind of cosmetic they are using, how the skincare is being taken care of, how is their lifestyle, how is their like routine, sleep routine, stress routine, everything, but the tone also matters. So the Fitzpatrick scale comes into the action, correct? Now the common mistakes which we or aestheticians usually does. Number one, they do the guessing work. So let's not guess, okay, this is this kind of a color, I'll do. No. Fitzpatrick scale has got very fair, then olive, then they have got a wheatish color, then they have got dark, or we call it as a brown skin, and dark brown. So here the grade starts from 1, 2, 3, 4, 5, 6. So whenever you see a client, whenever you evaluate the client, whenever you check the client, you always had to note down the Fitzpatrick scale. So you can write the FS or FS, like you can give the grading 1, 2, 3, what grade you are thinking. So in a corner of the prescription or in a corner of a chart, you need to mention about the Fitzpatrick scale as well of the client, okay. That will actually lead the way that will actually lead the way for the treatment planning in your whole complete treatment protocol. Now the wrong settings, because you don't know which Fitzpatrick scale the client lies on. Example, the client lies on the, for example, grade 4. You did the setting according to the grade 1. So the client is going to have the irritated skin and the melanin deposition more. Similarly, if the client is on the grade 1 and you are making like a very different kind of settings, for example, for like a person who is on grade 4 or 5, so they will not get the appropriate result. So that is the reason Fitzpatrick scale is matters, because intensity, frequency, wavelength and the things changes accordingly. Now, no patch test. You don't do it. Do you? So if you do not have a tendency or you do not have a habit of doing a patch test, please make it a habit, because it is going to save you a lot of complications and problems in future. Okay, last but not the least, ignoring the history. Person came to you, they are healed, their skin is looking good, they told you a history of laser damage or they told you a history of laser burn back, and you didn't took that history, you didn't take that history, you actually avoided it, and that mishappening led to you, and that decided your treatment, and now the complication is standing on your door. So if you want to avoid the mishappening, please make sure you follow each one of it, otherwise you are always going to land up with a complication. Okay, and yeah, one more thing not mentioned here, but I'll just say, please know about the treatment and procedure beforehand. Don't experiment. Okay, you cannot experiment with your clients. They are not an experimental baits. You need to know what you're doing. You need to know, have all the knowledge. You need to have the theoretical, practical, both the knowledge, not just the practical knowledge, but the theoretical as well, because both are important to decide a treatment and to work accordingly. Okay. Now the basic key takeaways that we get from this whole complete video or the whole complete topic is, number one, identify. Obviously, if any of the client walks into your setting or walks at your premises, it becomes your duty to make sure you identify their primary problem, and with that you identify their skin type, tone and their texture, the problems, the kind of any kind of history, any kind of skincare, any kind of allergies, any kind of anything that is correlated with that has to be interlinked. And the best thing to do is write it down. When you write it down, you never misses out anything. Number two goes assess. Not just assess with eyes, but use certain kind of instruments as well that helps you to assess beautifully and easily and make your works easier. Then goes protect. Obviously, if you see the skin tone which doesn't, or the kind of skin which is not healed, which is very damaged already, you need to protect that skin beforehand, before prescribing any skincare, before prescribing any treatment. So the first instinct that goes with you is healing, protecting, and then moving beyond anything else. Now next goes the treat and review. Obviously, you need to treat the client perfectly and according to their skin type and tone, and not randomly. Okay, after treating the client, don't miss out with the clients. Keep a review with yourself so that it becomes your permanent client or comes with a repeated orders. Okay. Now, basically, when we are talking about the Fitzpatrick scale, the whole thing, the whole gesture which we just talked in the whole video comes to a basic one-line summary. Please note down the Fitzpatrick scale, see for the tone, and then decide the treatment protocol. That will always save you from any mishappening and complications. If you are watching us till here, till the end, then don't forget to subscribe the channel and hit the notification bell icon, because we are going to keep coming back again and again with such informative videos again. So till then, bye-bye, take care.